Welcome to another episode of MedMadness, where we dive into critical topics that shape the world of medicine. Today we're focusing on a pressing issue, prescription drug misuse, with a particular emphasis on opioids. Opioid misuse is a significant contributor to the rising number of fatal overdoses, making it a crucial topic for both healthcare professionals and the public to understand. Opioid misuse occurs when these medications are taken in ways that deviate from the prescribed manner or for purposes other than intended, such as to relieve anxiety rather than pain. This misuse can also involve obtaining opioids from multiple prescribers using non-prescribed opioids or concurrently using recreational drugs. The consequences can be severe, including addiction, overdose, and even death. To help combat this, tools like the Prescription Drug Monitoring Program, or PDMP, and urine drug screenings, or UDS, are invaluable. The PDMP tracks prescribed controlled substances, providing a detailed record that can help identify patients at risk of misuse. UDS, on the other hand, helps detect recreational drug use, verify adherence to prescribed treatments, and identify potential medication diversion. Next, let's discuss how these tools work and why they are so important. The Prescription Drug Monitoring Program, or PDMP, is a state-specific database that records all controlled substances a patient has received, including the quantities, dates, and prescribing information. By querying this database before each refill, healthcare providers can identify patterns that suggest possible misuse, such as obtaining opioids from multiple prescribers. This proactive approach helps prevent overuse and diversion, ensuring patient safety. Urine drug screening, or UDS, is another essential tool in long-term opioid therapy. It detects the presence of recreational drugs and confirms whether patients are adhering to their prescribed treatments. However, in-office UDS can sometimes yield false positives or false negatives due to cross-reactivity with other medications or incomplete detection of substances. Therefore, unexpected results should always be confirmed with more specific tests, such as gas chromatography with mass spectroscopy. These practices are part of a broader strategy for opioid prescribing, which includes screening for risk factors before initiating treatment, regularly querying the PDMP, and conducting random UDS during therapy. This comprehensive approach helps healthcare providers manage opioid prescriptions more effectively, minimizing the risk of misuse and enhancing patient outcomes. Consider the case of a 45-year-old patient, Mr. Johnson, who was prescribed opioids for chronic back pain. Over time, his physician noticed that Mr. Johnson was requesting refills more frequently than expected. By querying the PDMP, the physician discovered that Mr. Johnson had also been receiving opioids from another doctor. A subsequent UDS revealed the presence of non-prescribed opioids in his system. Confronted with this information, Mr. Johnson admitted to using opioids to manage his anxiety, a condition for which they were not prescribed. This early identification of misuse allowed the healthcare team to intervene, providing Mr. Johnson with appropriate counselling and adjusting his treatment plan to address both his pain and anxiety safely. In today's episode, we've explored the critical issue of prescription drug misuse, particularly with opioids, and the tools available to healthcare providers to monitor and prevent it. We discussed the importance of the PDMP and UDS in ensuring the safe and appropriate use of these powerful medications. As you continue your studies, remember the significance of these tools in real-world practice. To reinforce what you've learned today, be sure to engage with the pre- and post-podcast quizzes and review the Anki flashcards we've prepared. These resources will help solidify your understanding and prepare you for future challenges in clinical practice. Thank you for joining us on MedMadness. Until next time, stay curious and stay informed.